6 weeks at home. Oh, ladies, and by the way, I want to make sure that you guys know that you can pop in your questions in the Q&A section, and we'll be presenting those questions to Dr. Ahmed shortly. So, Dr. Ahmed, any additional information you want to share with the ladies before we go to their questions?
Sure. Let's see if we can go through these slides a little bit. So, you know, for me, one of the most important things when it comes to personal health is education. So for me, I think it's an honor to be here because this is an educational seminar, and we're trying to educate women on what are some of the options out there. So uterine fibroembolization is a very well-established procedure, and it's been around for a very long time. But unfortunately, even in 2020, the information out there is very limited, and a lot of women will not be given this option because for one reason or another, maybe either their gynecologist is not aware of the procedure, or you know, maybe the area where they are, it's not available, etc. But even back in 2004, Condoleezza Rice had this procedure done. And now we're in 2020, and still there's a lot of women still getting hysterectomies. I just looked it up. I think there are 600,000 hysterectomies performed here in the US. And one third of women in the US will end up with a hysterectomy by the age of 50. So you can imagine, one, how common fibroids and are in the population, and two, how many women are ending up with hysterectomies. And you can also imagine how many of those women are probably not even told about this option. So that, you know, education, again, from my perspective, the most important thing we're doing here today is about education. Whether you choose to have a hysterectomy, myomectomy, fibroembolization, the most important thing is that they know that this option is out there.
That it's available. When we have options and when we have choices, then hopefully and prayerfully we'll make better choices. Exactly. as opposed to just having one option. So we do appreciate you. Anything else?
No, I think that was about it. Okay. Probably a good time for questions.
Very good. Well, we got plenty of them for you too. And ladies, don't forget, you can still put those questions in, and we will get to your question as well. Okay, so here's our first one. I'm 45 years old and I've been diagnosed with 8 fibroids. They are small to medium, but one is the size of an orange. Will this fibroid continue to grow, or will they begin to decrease with age?
So once you hit menopause, the hormones that cause fibroids to enlarge, those hormones dramatically decrease. So after menopause, the size of the fibroid will decrease over time. And the assumption is that as the fibroids decrease in size, the symptoms that you're having associated with the fibroids, such as bleeding, pain, etc., will also improve. Now, the time frame for how long it takes the fibroids to shrink after menopause is not clear, and it varies, you know, from one woman to another. But the fibroids, yes, as the hormone levels decrease, they should decrease in size as well over time after menopause.
Okay, so here's the second question, and I think we answered the first part, but they're asking, how long does the operation take, and are we under anesthesia?
So the operation itself, I don't even call it an operation. It's more of a procedure where a minimally invasive procedure. So it can take up to an hour, but on average, it's somewhere on the order of about 30 minutes to 40 minutes for a typical procedure. We don't give general anesthesia for the procedure because, again, patients are very comfortable. They don't feel any pain. We numb up the area where we're going in the wrist, but we also give what's called twilight sedation or moderate sedation, which is a combination of medications which basically makes you feel like you're getting a good night's sleep. So you won't be in any pain, you won't feel any discomfort, and you should be awake from those medications, that type of anesthesia, within 20 minutes after the procedure.
Wow, Okay. So here's our next one. Can fibroids affect a woman's vascular circulation? And do fibroids increase the risk of developing varicose veins?
That is an excellent question. Fibroids, they do, so there are very vascular structures. If there's any type of abnormal circulation, meaning maybe there's some type of arterial venous fistulas where because of the abnormal growth of the arteries, maybe there's a little bit more connection to the veins as well. I can imagine that that does create some abnormal circulation within your body, especially if the fibroids are large, especially if the uterus is large. And in that sense, there is an abnormal circulation that's created. Now, um, fibroids that are large can also have a mass effect, can actually press down on veins that are draining the legs. Okay, so you can imagine that there are these large veins that have to get the blood out of your legs and your feet, and they're all draining through the pelvis, and they're making their way back to allowing the blood to go back to the heart. Now, if there are large fibroids that are pressing down on those veins, they can certainly cause varicose veins as well. So because they're pressing down on the veins, they're preventing the blood from getting out of the legs and going back from the heart. And therefore, the only direction the blood can go is back down into the legs and create increased pressure. And that increased pressure translates into essentially varicose veins.
Wow. Never knew that that was associated with it. Thank you, Dr. Ahmed. Okay, so now this is more of a statement, but I'm going to give it because it's important. We have she said, my cousin died of a hysterectomy and no one knew that it was so risky. This is unbelievable. Why aren't doctors telling us about this?
Right. First, I'm really sorry about that. It's a tough situation when physicians are not completely open and honest about the risks associated with their procedure, especially a procedure of the magnitude of a hysterectomy, where there's a fairly significant chance of heavy bleeding, damage to adjacent structures, infection, etc.
Okay.
I don't have a good explanation for why the information is not out there about uterine fibroid embolization. What I can say is that uterine fibroid embolization has the highest level of designation by the American College of American College of Gynecology. So the
Okay.
American College of Gynecology has given uterine fibroid embolization their level 1 designation, which means it is considered first line treatment along with hysterectomy. Of course, we talked about the differences between a minimally invasive procedure and an open procedure, but they have that same level of designation. So I do wish, that more information is out there on fibroid embolization, and people understand, what type of risks they're taking when they're undergoing a fibroid embolization versus a hysterectomy or myomectomy. And I'm sorry to hear about your loss. That is
Absolutely, we're sorry, but we're so happy that you're here with us today, and all the women are here with us today to find out that information. Because as the old saying goes, if we knew better, we'd do better, right?
right.
Okay,
Exactly.
all right. Here's our next question. Now, what are the side effects and the actual downtime? I know you talked about that after the procedure. Is it true you will lose belly fat after this procedure is done? And lastly, she said she takes care of her mom and she wants to know how would that affect her in terms of being able to take care of a bedridden mother after the procedure.
Sure, that's an excellent question. So, um, one of the most, from what I find, talking to women about fibroid embolization and uterine fibroids in general, one of the most common reasons that the symptoms for uterine fibroids are ignored or set aside is because women are really busy. You know, they have to take care of the household, they have to take care of kids, they have to take care of, you know, their husband, etc. They're working, they might be working multiple jobs, and the amount of downtime that's associated with the option that they're given, like a hysterectomy, is just too much to take on, and therefore those symptoms get ignored, the fibroids get larger, etc. So the great thing about uterine fibroid embolization, I think one of the best aspects of the procedure is the recovery from the procedure. So it's a very short recovery. What I tell my patients is that what you should expect is for the first 2 to 3 days after the procedure, the pain may get a little bit, it may increase a little bit. And that pain is very well controlled with the medications that we give, which is a combination of an NSAID and also a pain medication that helps control the pain. Usually after that 2 to 3 day mark, patients start to feel significantly better. And I would say 95 to 99% of patients that I treat, by day 4, day 5 after the procedure, they're essentially back to their normal selves. So they're back to work, they're back to all of their normal exercise, activity, you know, activity with the kids, their parents, etc. So my expectation is that somewhere between 2 to 5 days is going to be your window of recovery. And after that window, you're going to be back to your normal activities.
Okay. Now, what about that belly fat question? She asked, does this help reduce belly fat too?
So that's a really important question.
I think everybody's ears perked up on that one.
So large fibroids, like I was saying before, large fibroids give the appearance of belly fat, because essentially these are large masses. They're in the uterus. The uterus is sitting, you know, right underneath the skin, and that mass effect, the mass for the bulkiness of the fibroids, when you look at when you look from the outside, it looks like it's belly fat. It looks like, you know, some women actually look like they're pregnant.
Yeah.
And the way that a lot of gynecologists and, you know, myself as well will describe the size is actually by saying what term you would be if you were pregnant. Like, this is a 4-week belly, or this is a 6-week or
Wow.
8-week, you know, pregnant appearance. So after uterine fibroembolization, that size, the belly appearance that's related to the size, that will significantly improve. So you can imagine something that's the size of a cantaloupe going to the size of a pea, and how that appears from the outside. You know, so you're going to notice a big difference.
Right. So it makes your belly go down. It makes it look flatter. So
Exactly.
Not so much removing the fat, but removing the fibroid can make it look smaller.
Right. Exactly.
Okay. Okay. Very good. Now, here's another question. The embolization may freeze and shrink the fibroids, but how would women find out if they have endometriosis as well?
And endometriosis is a separate diagnosis. So endometriosis, you know, I don't want to get into the details of it, but essentially endometriosis, to put it very simply, is an abnormal implantation of endometrial tissue. So the endometrial lining is the inner lining of the uterus, okay?
Okay.
When that tissue, the inner lining of the tissue, ends up somewhere else, could be in a separate part of the uterus, it could be outside the uterus, it could be near the ovary, that tissue, when a woman goes through the monthly cycle, just like the endometrial tissue will enlarge, will bleed, will, you know, that other ectopic tissue, what they call ectopic tissue, meaning it's located somewhere beside its normal location, that will also undergo the cycle. And that can also be associated with significant pain, bleeding, etc. So that is a completely separate diagnosis. That is not something that we're treating with uterine fibroembolization, but that is also something that can be diagnosed with imaging, just like an ultrasound, for example.
Okay. So now here's a good question. Is it possible that a woman would not be a candidate for a UFE?
That's an excellent question, and there are very, very few women that fall into that category. The vast majority of women that I see with uterine fibroids, I would say over 95, 98% of women um, are good candidates for the procedure. Now, there that very small subset of women that may not be a good candidate for the procedure, um, those women may have a fibroid that is protruding out of the uterus, but it's protruding. Not only is it protruding out, but it's protruding out with a very small stalk. Okay.
Mhm.